Hi, my name is Nina. I'm going to talk about pediatric cardiac today. I am a nursing student, and this section is for study purpose, especially the Down syndrome child. So, if the child have diaper rash, the cardiac catheterization will be cancelled. Put direct pressure after the procedure is done to prevent bleeding, because bleeding is very serious condition, and make sure you keep your legs straight and stay in bed. The acyanosis caused by increased blood flow, pulmonary blood flow, and cyanosis is decreased pulmonary blood flow. Usually VSD with small one, every time that the ventricle contract, the blood from the left go to the right side. Let's say normally every contract the blood volume will go up 10, but because of the septal defect, so the blood that go throughout the body is only 8, because it's shipped back to the right side. So 8 out of 10 your body still don't get blue. The extremities doesn't get blue. But if you have VSDS, which is like the septal defect, this big hole in your heart, every time they contract, like maybe half the blood go to the right side, so that how like you don't, like let's say you get the blood 5 out of 10 every time the ventricle contract. Of course, you're gonna get cyanosis, and also you get clubbing now because you are hypoxia. Get it? Coarctation of aorta. Usually coarctation of aorta have a high blood pressure on upper extremity and lower extremity. So what you have to know is that you have to make sure that you check blood pressure, or you can check the pulse ox. Usually the upper gonna lower is higher than lower extremities. Next one gonna be Tetralogy of Flow. So basically it's 4 part of the heart is have a problem. Pulmonary stenosis, the thickening of the ventricular wall, and then the ventricular septal defect, and also aorta override. So what happened is that usually the patient with test spell, they will get cyanosis, clubbing nail. So you will get CHF, of course, because the left shunted to the right side. On the left side, it's anything that happened to the lungs, respiratory system, anything that have problem with that. But right-sided heart failure, everything that happened to right side, like what do you have on the right side is your liver, next vein detention, what else? So edema, peripheral edema, weight gain, and stuff like that. So goal of care for the CHF patient is to improve cardiac function, decrease oxygen demand. What you do is you give digoxin and Lasix. So digoxin, when you give it for the child, I think you have to check epical rate that less than 110 or 120 based on what book. So you hold the medication, and also you have to watch for the sign of toxicity, digoxin toxicity. So we all know what the sign is. The same thing, but in the child, usually nausea, vomiting, and bradycardia. Yes, nausea, vomiting, and bradycardia. And you give Lasix to decrease cardiac workload. So with the Lasix, and those stuff, so make sure that the child is in semi-fallow position, never lay flat, because what it is. And also you have strict INO. You have to check intake output and check their weight every day. So with intake output, the child is normally 1 to 2 ml per kilogram, so you just multiply it. Here's important point. The child have hypoxemia, so they will have clubbing nail, and also with the test spell, Tetralogy of Flow. So decrease the workload of for comfort measure, the child will be in the knee-chest position. Knee-chest position. Tip to know, besides or information you have to know, is that cyanosis in acyanosis heart defect, the side symptom is dyspnea because of fluid overload. So you will listen to the lung for rattle, crackle, whatever. Okay, for cyanosis can cause left or right heart failure. And what you know is that they usually have low blood pressure. Okay, so what involved about heart is so many things. You have to know about rheumatic fever, you have to know about Kawasaki, you have to know about Rye syndrome and aspirin, and those stuff they link to heart problem. So with rheumatic fever, because of the patient have the history of B strep, so they give antibiotic for prophylactic for the rest of their life. Every time before they do they have dental care or surgery. Again, coarctation is blood pressure on upper extremity is higher than a lower extremities. Knee-chest position for TOF. Kawasaki is a vessel heart problem, so usually you give aspirin and globulin vaccine to prevent infection and clot to the heart. Okay. Rheumatic fever sign and symptoms, usually you have chest pain, swollen joint, and the finger noodle in the fingers. So you have to know how to care for the patient. So you will be in bed rest, and use a warm compress to help with the comfort. Okay, so next one, when you give digoxin, do not mix digoxin with food, because what if the child don't eat the food, so he not take enough dose of digoxin. Diaper rash. If patient have diaper rash, no cardiac cath. So when you have after cardiac cath, to prevent bleeding, you apply 1 inch above the site, the femoral site. So PDA, potent ductal artery, usually they have a machine line of murmur, machine-like murmur. That means they have a PDA, potent ductus arteriosus. So Kawasaki, I think the second phase they have strawberry tongue. They're red and then the lips cracked. ACE inhibitor, you're not using in adults